The pharmacokinetics of Digitalis glycosides. In administration and absorption, Digitalis glycosides are usually administered orally, and the rate of absorption may be influenced by the specific pharmaceutical preparation of the drug. The distribution of this drug, Digoxin, is bound to the plasma protein to about 5 times greater than the digoxin. Digitoxin is eliminated through the liver and digoxin is eliminated through the kidneys. The clinical uses of this drug is for the congestive heart failure, cardiac arrhythmias, post-surgery use, toxicity, and dosage. There is no fixed dose for administration of cardiac glycosides. Here's the chart for the dosage of digitalis glycosides for dogs. The loading dose and the maintenance dose differs on what route is being used, oral or IV. There are different dosage in every species. For example, is in cats. Digitalization is generally not recommended in the digoxin, 0.01 milligram per kilogram. In horse for supraventricular tachycardia, 0.033 to 0.066 milligram per kilogram for oral administration of digitoxin and 0.06 milligrams per kilogram for digoxin, and in intramuscular and intravenous 0.022 milligram per kilogram. Cubane, intramuscular and intravenous 0.0132 to 0.022 milligrams per kilogram. For cattle, supraventricular tachycardia, intramuscular of 0.031 milligram per kilogram for digitoxin and 0.0132 to 0.022 milligram per kilogram in intramuscular and intravenous route.